This study was performed in the Universidade Federal do Rio Grande do Norte, Brazil, and it is entitled Ipomoea asarifolia neutralizes inflammation induced by Tityus serrulatus scorpion. Envenomation caused by scorpion sting is a public health problem in many countries, increasing the research interest in this topic. In Brazil, Tityus serrulatus of the family Butidae is the most dangerous scorpion due to the high toxicity of its venom, which may lead to death, especially when the victims are children. The venom of these animals induces severe systemic manifestations, including cardiovascular disorders and pulmonary edema, and intense inflammatory response. The treatment to envenoming consists of supportive therapy and serum therapy, depending on the symptoms reported by the patients. Furthermore, the current antivenom therapies in most cases are not able to effectively counter the local effects caused by the venom, sometimes producing adverse reactions in patients, such as hypersensitivity. Many plants have been used as an alternative treatment for envenoming by venomous animals in an attempt to minimize local inflammatory effects. Although several studies have reported the local treatment of snakebite using plant extracts, few studies have demonstrated the efficacy of such local treatment in poisoning caused by scorpion sting. In folk medicine, it is common to use leaves from species of the Ipomoea genus to treat inflammation. The aim of this work was to evaluate the ability of the crude extract and fractions of Ipomoea asarifolia to neutralize the inflammation caused by Tityus serrulatus envenomation in mice. Ipomoea asarifolia leaves were used to prepare the aqueous extracts and fractions. Different groups of mice were inoculated intravenously with saline, aqueous extracts and fractions of Ipomoea asarifolia, or pure routine. A few minutes later, the animals were injected intraperitoneally with sterile PBS or Tityus serrulatus venom. After 6 hours, the animals were euthanized and peritoneal exudates were harvested by peritoneal wash. Exudates were centrifuged and the total cell numbers were determined. The supernatants were collected for determination of cytokine levels. A phytochemical screening revealed the presence of phenols, tannins, alkaloids, and flavonoids in Ipomoea asarifolia leaves and indicated the presence of rutin. The in vitro cytotoxicity of aqueous extracts of Ipomoea asarifolia at different concentrations was evaluated in 3 T3 cells after 48 and 72 hours incubation. The results showed that the concentration of the aqueous extract used in this work presented low toxicity for the cells. All mice groups treated with Ipomoea asarifolia aqueous extracts and fractions showed a significant inhibition of the cell migration into the peritoneal cavity and reduction on the cytokine levels when compared with the control group. Taken together, the data suggests that inhibition of the inflammation induced by Tityus serrulatus may be due to the presence of flavonoids in Ipomoea asarifolia leaves. In conclusion, this is the first study showing that aqueous extracts and fractions of Ipomoea asarifolia can counteract the inflammatory effects caused by Tityus serrulatus scorpion venom in mice. This work also suggests that flavonoids present in the plant, especially rutin, may be the chemical components responsible for this activity. The neutralization occurs by inhibition of leukocyte migration as well as by a reduction in the levels of IL-6, IL-12, and IL-1 beta. Further studies are necessary to determine the anti-inflammatory mechanism of action of Ipomoea asarifolia and its potential anti-tumor activity.